This medicine is used to relieve pain from nerve damage caused by diabetes, shingles infection, or spinal cord injury. It is also used to treat pain in people with fibromyalgia, and to help control certain types of seizures when used with other medications. Before you start taking Pregabalin, make sure to read the medication guide and patient information leaflet provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 3 times a day. The dosage is based on your medical condition and response to treatment. If you are using the liquid form, carefully measure the dose using a special measuring device. Your doctor may direct you to start at a low dose and gradually increase it to reduce the risk of side effects. Take this medication regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as it may cause withdrawal symptoms. This medication may sometimes cause addiction, so take it exactly as prescribed to lower the risk. Tell your doctor if your condition lasts or gets worse. Some common side effects of Pregabalin 200 mg capsule may include drowsiness, dizziness, dry mouth, constipation, difficulty concentrating, or weight gain. If any of these effects persist or worsen, notify your doctor or pharmacist. Remember, your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience serious side effects such as blurred vision, unusual bleeding or bruising, confusion, muscle pain or weakness, swelling of hands, legs, or feet, or signs of kidney problems. A small number of people taking anticonvulsants may experience depression, suicidal thoughts, or other mental/mood problems. Contact your doctor immediately if you notice any sudden changes in your mood, thoughts, or behavior, including signs of depression or thoughts of harming yourself. Seek medical help immediately if you experience very serious side effects like slow or shallow breathing. And while a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. And remember to call your doctor for medical advice about side effects, and report any side effects to the appropriate regulatory authority. Before taking Pregabalin, make sure to tell your doctor or pharmacist about any allergies you have or if you have any other medical conditions. This medication can make you feel dizzy or drowsy, so it's important to avoid alcohol and marijuana while using it. It's also important to let your doctor know about any other medications or herbal products you may be using. If you are pregnant or breastfeeding, talk to your doctor before using this medication. Older adults may experience more side effects from this drug, so it's important to be cautious. It's important to be aware that Pregabalin 200 mg capsule can interact with other medications, potentially affecting how they work and increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Don't start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Pregabalin 200 mg capsule is orlistat. Taking this medication with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, may increase the risk of serious side effects like slow or shallow breathing, severe drowsiness, or dizziness. It's important to inform your doctor or pharmacist if you are using any of these products. Additionally, it's important to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, be sure to ask your pharmacist about using these products safely. If someone takes too much of this medication and has severe symptoms like fainting or difficulty breathing, it's important to call for emergency help. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It's important not to share this medication with anyone else because it's against the law. Your doctor may also want to do some lab tests, especially to check your kidney function, while you're taking this medication. Make sure to keep all your medical appointments and talk to your doctor if you have any questions. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take an extra dose to make up for the missed one. You should store Pregabalin 200 mg capsule anticonvulsants, Gaba-Derivative-Type at room temperature away from light and moisture, and not in the bathroom. Keep it away from children and pets. Also, do not flush it down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, properly discard the product. You can consult your pharmacist or local waste disposal company for further guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.